News right off the top tonight that will have far-reaching effects when it comes to battling COVID-19. FDA granting emergency approval for SUNY Upstate Medical's saliva swab test.
Now that's a test that originally only had state health department approval. So what does it all mean? Associate Professor at SUNY Upstate Frank Middleton joining us live via Zoom. Thank you, Dr. Middleton, for being here tonight.
You're very welcome.
So I think one of the biggest things people want to know, so they hear like it's been gotten an emergency approval. So how does this roll out? We know it's been used on college campuses here, especially the SUNYs, but when would it be made available for everyone? Like where could I find it? Where could other people be able to use this?
So as of right now, the test can be adopted by any clinical laboratory that's authorized to perform these types of tests anywhere in the country. And that includes commercial providers as well as academic medical centers. Here in Syracuse, Upstate Medical University is providing the test, the saliva test is being deployed. So there are daily collections. Individuals can sign up to have, if they're symptomatic, to have saliva swabs taken at NBT Stadium. And there is a process for doing that. But we envision this test will take on much more popularity, certainly around the country, not just here in New York State.
Is it a matter of a doctor's office, for instance, an urgent care or the Syracuse Community Health Center, of just getting the tools, I guess, and then sending those results back off to you? Or is it really limited to just what you guys are able to do and collect?
There are a number of different scenarios that can apply to answer your specific question, Jeff, but part of it is that it requires an order. There's emergency use authorization, so it doesn't have to be a physician order, but it has to be an authorized individual who issues the request for an order, unless it is a surveillance test authorization. And actually, we received authorization in New York State to perform surveillance testing in asymptomatic people as well.
I wonder if you could talk about the impacts of this approval now that it's going to have a larger reach.
Well, already in New York State, through our use of the asymptomatic screening in college campuses, we've performed over 80,000 of these tests. We've screened more than 80,000 college students. And we have found asymptomatic clusters on campuses. And we think that's really critical to winning the war against COVID, is knowing where it's hiding out. And in young, healthy people, it hides out really well because so many of them might think they don't have any symptoms at all, but they could bring that virus home with them over the weekend or on a break, a holiday break. And so that's what the college campuses are now really gearing up to try to prevent, is this sneaky spread of the virus. And this tool helps us detect it.
How accurate are these saliva tests compared to what we have been using? Obviously, they must work well because, again, you were using them at SUNY and some other places that needed them fast, but how accurate are these tests?
These tests, this test in particular, is as accurate as anything else that's been developed. So it's as accurate as the nasopharyngeal swab that a healthcare provider could order. And we had to meet extremely high standards to receive the FDA authorization, or we wouldn't be able to make that claim.
And in the global race to find a cure for COVID, will this play a role in efforting a vaccine at all?
We think it certainly can. We don't intend to stop here. We intend to push the technology and the ability to monitor not just the presence or absence of the virus, but the levels of virus. And knowing that someone who's received a vaccine might develop a very mild level, but maybe not a full-blown case of COVID, would be very informative to the medical and research community. And this type of technology and the sensitivity of this test enables us to think about applying it in that context as well.
Associate Professor at SUNY Upstate Medical, Frank Middleton, congratulations and thanks for spending some time with us on this. We really appreciate hearing from you tonight, and probably going to hear a lot more about this in the days and weeks to come. Thank you so much.
You're very welcome. Thank you.
Now, to learn more about the FDA's approval, we have that for you at localsyr.com.